Your brain is your body's control center, shaping how you think, feel, and move. When something goes wrong, it can affect everything. Welcome to Your Brain, Your Health, a podcast from St. Luke's Neurosciences. We'll explore conditions that impact the brain, spine, and nervous system, and how they connect to your overall well-being so you can stay informed and take charge of your health. Hi, everyone, and thank you for joining us today on today's episode, Healing, Adapting, and Living Fully After Stroke. I'm your host, Dr. Eric Eustace, an emergency physician at St. Luke's University Health Network, and I'm joined today by our guest, Dr. Daniel Ackerman, Section Chief of Neurology and Director of Stroke and Vascular Neurology here at St. Luke's. Dr. Ackerman, thanks for being here. It's always a pleasure. Welcome back.
Eric, thanks again for having me, and I'm really excited about this topic. When I teach about stroke, I spend a lot of time talking about signs and symptoms and risk factors. Stroke recovery is a whole nother ballgame, and I'm just really glad we're going to get into it.
We're going to dive into that today, I think. So what actually happens to our body, mind, brain after a stroke, and how do we rectify that?
So stroke is a brain injury, and it is a sudden brain injury. It's immediate. For the vast majority of strokes, there's no lead-in. There's no, hey, I felt sick for a while. I'm not saying that never happens. It's just unusual. The brain controls everything the body does. So that includes how we perceive the world around us, how we understand things, both understanding how things work and understanding communication, whether we're talking about reading or listening to a podcast or having a conversation. The brain, of course, controls our movements and our strength. It controls our coordination, which is totally different. It controls all of the different sensations, and there are 4 or 5 or more different types of sensation in the body. Then, of course, there's things like thinking and memory. There are so many different aspects of what our brain does that helps us to be who we are. Any one of them can be impacted by stroke.
Sure.
Now, for some people, stroke recovery, at least from a symptom resolution standpoint, can go relatively quickly, but most of the time it takes a long time, far longer than you would typically think for some other kind of body injury. However, the emotional recovery and getting back to normal in giant air quotes, right? That's a whole different layer of this.
So I'm assuming when somebody has a stroke, they do stay in the hospital for some period of time. How soon does that recovery begin for that patient?
So the recovery itself, the healing process does start right away, but because the brain is very, very delicate, and this is an injury, that process starts with a little bit of inflammation or swelling around the injury, and then slow kind of stabilization. Stroke tends to leave a scar in the brain, just like on the skin or anywhere in the body. That scar takes time to form and settle down. Now, the brain, just so everyone understands, the brain is roughly 86 billion, with a B, neurons, all connected in these complex networks. Sometimes when people ask me, well, what part of my brain was injured and what does that part do?
Sure.
That, we could do a neurology program together and take a while for that. But there are some specifics that each part of the brain does that we can sometimes refer back to. Either way, the recovery does begin right away, and yes, we start the rehabilitation process right away. So usually in the hospital, we start with things like physical therapy, occupational therapy, speech therapy. Now, depending on how significant someone's symptoms are, when they leave the hospital after a stroke, they may go to one of a few destinations. Ideally, we want them to be able to just go home. Mm-hmm. And depending on not only their symptoms, but their living situation and who else is in the home and what is their lifestyle like, that may or may not be feasible. Other options can include, you mentioned going to a rehab, and some people might not know quite what we mean by that. When someone goes to a rehab or a rehab facility, so this is not a nursing home, okay? This is a separate kind of hospital that specializes in rehab and recovery.
Okay.
And it is a place where you get several hours of therapy every day. So much more, and that's every day, much more than what you would get doing like an at-home program where you're going to a physical therapy center twice a week or something like that. And the amount of time someone spends in a rehab center is very variable, from days to a week up to several weeks, depending on what a patient's goals are, how quickly they're progressing, what they have to achieve to be able to get back home. And so that's all joint decision making that people work on together. For people who have more severe strokes, there are a few other places like what we call skilled nursing facilities, places that can provide that additional care. But for patients who perhaps can't tolerate 2 or 3 hours of physical therapy every day. So there's a wide range of places, and it's not just about what symptoms someone has or even how severe those symptoms are, but it's also about what is their recovery potential, what lifestyle are they trying to get back to, again, what's the living situation, how much help is there, all of that stuff comes into play. Our goal is to get people at home, but to get them at home safely.
Yeah.
And in a place where they can actually begin on that road to recovery.
I'm sure, like we talked about, the complexity of different strokes and how individualized it is per patient regarding their family situation, their lives. I think the great thing about St. Luke's and what we have to offer within the network is we have a number of different places that patients can go and get recovery for their stroke, but not just for their stroke, for their other illnesses that they're going through. It's funny. I think a little bit about the mental health aspect of stroke recovery. It must be extremely distressing for somebody to be going through this, the impact for them as a patient, the impact for them as a family. How does that relate, and how do we deal with the mental health aspect of recovery?
So statistically, anywhere from 30 to 50% of people after a stroke will have post-stroke mood changes. Okay, so that's one in every 2 patients, half of everyone, up to maybe 1 in 3. Now that happens not only because stroke is awfully scary, and when you ask people what you would rather have, a stroke or a heart attack, the vast majority of people would say, well, if I have to choose one, a heart attack. Yeah. Stroke is scary, but aside from that, as you mentioned, it's a brain injury. It's going to mess with the chemistry in our brain. It's going to mess with how the parts of our brain talk to each other. So the most common one we would talk about is post-stroke depression. But I will tell you, in my practice, I would say post-stroke anxiety is just as common, if not more common. And it's really important to call this out because these are treatable stroke symptoms. For a lot of the stroke symptoms and stroke recovery we talk about, we're going to give people tools to help them recover, help their brain recover, help their function to improve. But it's not a case where you can give someone a medicine that's just going to make it better. Thankfully, post-stroke mood changes are responsive to medicine.
Okay.
And actually, there's a really significant body of evidence that tells us if we leave that untreated, it can have a real impact on people's ability to recover after stroke and even what we call their mortality, their ability to survive long-term after stroke. Post-stroke mood changes completely separate from issues with communication or thinking. Just the mood itself is a big deal.
It's funny you mentioned that because as an emergency physician, I've always been focused on the physical aspects of stroke and recovery, not moving a limb or not being able to walk. But it's to hear you speak about, mood changes and mental health. It is very complex. And I really never really thought about that in terms of recovery of patients and how it affects their moods, let alone their day-to-day aspect of how their brain functions, because their brain is tied to everything that they do.
Interestingly, that also plays a big role in deciding who would qualify for certain treatments.
Really?
When we talk about, so going back to what we discussed last time and talking about acute stroke treatment, the idea of how disabling, again in giant air quotes, how disabling a stroke is not just about does the arm move, does the leg move, can they talk, that sort of thing. It's really looking through the lens of this person's life and lifestyle. How significant would these symptoms be from the standpoint of interrupting that and creating an issue?
Sure.
Someone who has a little bit of slurred speech after their stroke and they are podcast hosts or trial attorneys, or their job requires them to talk a lot, well, that might be a career-ending injury for them.
Right.
Whereas your average person, well, it might not be nearly as big a deal. So when we consider, sometimes people ask me, well, how severe was my stroke? Well, it's not just about size. I usually say it's kind of like real estate. It's about location first and then size. But really, it's about what is the impact on your life going to be? And so you can't even compare two people who have the same or very similar symptoms. It may have a vastly different impact on their life and lifestyle.
Yeah. So speaking of recovery, how does diet and exercise affect that? in the long-term prognosis of a stroke patient?
So actually the initial impact of diet, exercise, and the like starts way before the stroke even happens. So when we talk about overall brain health, there is a concept in neurology, we call it cognitive reserve. And cognitive reserve is kind of like how much of an injury or how much of a challenge can happen in the brain where you can just compensate for it and keep going, okay? And so things like diet, physical exercise, mental exercise, adequate sleep, all of these things help to keep the brain healthy, and a healthy, strong brain is going to recover better. It will recover more quickly. It will compensate better for the damage that happens in a stroke than a brain that has not had those advantages. So even sometimes I see people who've had a stroke and they say, but I do everything right. And we have this conversation about how, yes, and that's why you're doing so well compared to what things would have been otherwise.
Got it.
Beyond that, absolutely, stroke recovery is it is an entire lifestyle shift. And things like diet, appropriate rest, good physical exercise, all of these things can help to speed that recovery along, again, by supporting the brain and supporting brain function, and by establishing good habits that will not only help someone recover from this stroke, but also help reduce the risk for another one.
This is related to family members of patients who have had a stroke. How can we support those individuals and patients in our lives who've experiencing something so devastating as a stroke?
Well, I think there's a couple of really important points, and of course, again, every individual, every family dynamic is going to be different. First of all, though, recognizing again the importance of those non-motor symptoms of stroke or the non-mechanical symptoms of stroke. So recognizing when a stroke survivor, someone who has had a stroke, is experiencing mood changes or fatigue, appetite issues, sleep issues. The patient who's going through 800 things may not always be able to recognize those changes, and they are very, very treatable. Number two, recognizing that individuals, as they're recovering from stroke and they're having difficulty, it's not just a matter of effort. It's not just a matter of if you would just try a little harder or focus a little more, it would be going much faster. It doesn't work that way. And you have to strike that balance between allowing people to push and do as much as they can do, but not forcing them to do more than they can do. And that's a tough balance to strike for folks. Beyond that, there are other ways to support stroke patients by helping them with rehabilitation, with transportation, with after a stroke, when we reorganize things in our lives around having had a stroke, we do it in two ways. One way is to push us to get better by helping us to practice the thing that's a problem and helping us to work on it. The other way is to accommodate for it, meaning to adjust our circumstances or our environment so that the issue that has happened after a stroke has less of an impact. Now, accommodating for a stroke issue kind of helps maybe get back to a sense of normalcy a little faster, but it also doesn't push recovery as much. Still, if all you do is push recovery and you don't accommodate for anything, well, then you're stuck in a bit of a rut. So it's figuring out that balance. And that's where a great therapy team, a physical therapy team, occupational therapy, speech therapy, sometimes a physical medicine and rehab physician can play a huge role in providing patients and their families guidance on how to do that, how to organize that from day to day. And there are great stroke support groups as well that are not just for stroke survivors, but also for their, what we can just say, caregivers, because that could be a family member, a friend, a cousin, an acquaintance, whomever, right? But being able to be there with a stroke survivor, or to go yourself to hear about people's experiences and understand their process and what their recovery has been like, it provides some great validation for what someone has gone through, and it gives them a chance to glean some great ideas about, hey, what worked for someone else that maybe that'll work for me.
Yeah.
Yeah.
So I'm an emergency physician. I deal with people on their worst days in the emergency department. And so I really try to focus on positivity and hope to keep myself motivated, but also patients and families motivated. Can you share with us any hopeful stories of recovery that you've encountered in your practice?
Let me tell you about two.
Okay.
All right. So one that comes to mind is a young woman who experienced a stroke. Remember, 10% of all strokes happen in people under age 50. That was her. She's a young woman. She was a teacher. She experienced a stroke due to an artery injury. And then in the process of repairing that artery injury, she had an additional episode where she couldn't read at all. And she's teaching children, and she can't read. And afterwards, being able to work with her through the therapy process, through her recovery process, she was able to completely regain that function. And as we've been able to work together in the office, she's told me about things like exercise and diet, all of these different things that she's doing to really keep things going and to keep them moving in a good, positive direction. She actually even connected with the American Heart Association, which is also the American Stroke Association, and worked with them kind of in a fundraising capacity, telling her story about the treatment she received and her recovery and what it's meant for her. The other piece of this, there are a lot of people I've seen who had a stroke many years ago. Now we've got some therapies that are approved for people with chronic stroke. So people who've had strokes 9 months, a year, 2 years, 5 years, 10 years down the road, things that we can actually do to help them recover some function that, conventional wisdom might tell us was unrecoverable. And being able to sit with patients and tell them, hey, I know you're still struggling with X, Y, or Z. Now there are some things we can do for that, even though your stroke was however long ago. I mean, once someone is a stroke survivor, they're always a stroke survivor, right? That even if their symptoms melt away entirely, that's always a part of them. But now that there are things we can do, not just for people who've had significant stroke right at the time, but even long term, it's again a whole new ballgame.
Awesome. So is there anything for our listeners, that the one last thing you want them to know about the recovery process in stroke, Dan?
Well, I would say, again, first of all, it is frustrating.
Yeah.
When people say, what can I expect? One of the things I tell them is, I promise you will be frustrated. It is slow and takes time. And often patients really can't even see how they're recovering. And it's really a lot of fun to be able to bring someone back to the office after I haven't seen them for a while and to remind them perhaps of what they were not able to do before that they are doing now, and to be able to look at the notes from their therapists and the like. That would be, so just remember, yes, it's going to be frustrating, but recovery means something different to each person, and that becomes a lifelong process of growth and improvement. And the brain is just amazing. There is no limit to that potential in my mind. Is it possible that someone will have a stroke and they may never feel or act exactly 100% the way they did before, as though the stroke never happened? That's possible. Even if their symptoms melt away entirely, they'll still know they had a stroke.
Right.
And things might still feel a little different, even if someone meeting them on the street would never know that they had a stroke. But there are so many things we can do now. So that message of hope is huge.
Yeah. Well, Dan, it's been a pleasure, as always. Thank you so much for sharing with us your insights on recovery for stroke. And until next time.
Good to be with you, Eric.
That's it for today's episode of Your Brain, Your Health. We hope that this episode gave you clarity on stroke recovery and living your best life fully post-stroke. Till next time. Your brain health matters, so keep learning and listening. If you found this episode helpful, share it with someone you care about. And for more resources on brain health, visit St. Luke's Neurosciences at sluhn.org. Until next time, take care of your brain and your health.